we're going to turn it to Mr. Adam Swanson.
Thank you, Colleen. Good to see you, Ursula, and thank you all for inviting me to be here today. My name is Adam Swanson. I work at the Education Development Center. I am a senior prevention specialist on the Suicide Prevention Resource Center project. In my role, I provide direct consultation and support to state agencies, public health groups, and other state systems around the implementation of public health approaches to suicide prevention. I'm also a member of the National Suicide Prevention Lifeline's Lived Experience Committee. And today I am kind of taking off my public health hat, and I'm really considering myself to be here as an attempt survivor. And I think what I want us to think about is how we're considering a person-centered and a community-centered approach at any time we offer an intervention or try to provide support to people. And I think social media provides a really unique outlet to consider how we provide help and how we build community. So I just want to start by saying I don't struggle with thoughts of suicide in the way I once did. That said, at times when I have in the past, and it's been quite a long time, my attempts to locate help did result in a highly traumatic experience involving the police, whom I did not call. So when we're having these conversations, and I was really encouraged to hear on the last webinar some mentions about what type of intervention is most appropriate and how are we gaining the autonomy of the person who's experiencing a crisis, I have a particular experience with that and particular thoughts. And through that experience, I've shared really openly among my networks about my experience. I've discussed what I went through with friends and family, and I've presented on the personal implications of ineffective prevention systems at conferences, and I've been cited in several news stories. So I've been very public with my own experience because I don't really believe that shame is a productive reaction to these types of experience. And through that work and through that, vocalization of what I've been through, I've become a person known in my network, including social media, as a person who's comfortable discussing these challenges, discussing suicide and suicidal thoughts as if it were any topic, right? Like the Met Gala meets suicide prevention, right? Social media can be an ether of all types of conversations. So for all that speaking and work that I've done in suicide prevention, I have noted that a lot of people come to me with concerns either about themselves or other people. And at no point in my over 8 years now working directly in suicide prevention has anyone ever approached me in person. Every approach has occurred over social media, whether that's a direct message, whether that's a comment, what have you. And their families too. As a vocal person, people are seeking help and advice. So my question becomes, what is the job of the data tool in building that connection, right? I looked up Meta's mission statement, and the mission statement, part of it is to give people the power to build community. So my question becomes, when we're talking about issues of suicide prevention, how are we supporting that network that surrounds a person who is experiencing a suicidal crisis and has made that known using the tools of social connectedness that exist online? Data science enables all kinds of knowledge, and it needs to be used for purposes that meet a standard of ethicalness. If I know someone's experiencing a suicidal crisis in my real life, I need to know how to handle that equally online. So I guess where I want to kind of focus this conversation today, or at least my contribution to it, is really asking, how are we empowering the network that surrounds a person to provide actual support within that moment of suicidal crisis? How are we informing that network of what types of interventions will be put into place? How are we building that community? And how are we being transparent in how our platforms can or cannot support someone who is experiencing suicidal ideation or a suicidal crisis? Ultimately, I think it comes down to an ethical, person-centered approach. And I'd encourage anyone who is attending this webinar from the technology companies kind of leading these innovations to really consider how are we doing that and how are we involving the experiences of people who have actually lived through these types of situations and how we're building our interventions. So I look forward to the rest of the discussion, and I'll hand it back to Ms. Carr.
Thank you so much, Adam. Really appreciate that